After the Supreme Court overturned Roe v. Wade, Alabama was one of the first states to overturn reproductive rights.
News 19's Kayla Smith tonight takes a look at the landscape of reproductive rights and health care here in Alabama.
Access to reproductive health care in general has deteriorated in the state of Alabama.
That's how an advocate described the state of women's health care in Alabama 2 years after the overturn of Roe v. Wade. Unite for Reproductive and Gender Equity, or URGE, has sought to increase reproductive rights for Alabamians. Austin Roark, the organization's Alabama policy director, says reproductive health care extends beyond access to abortion.
We have a health care system that, regardless of Roe falling, isn't set up to support people giving birth.
Alabama has remained in the spotlight of reproductive issues nationally after banning almost all abortions 2 years ago. This year, the Alabama Supreme Court made a decision classifying frozen embryos as children, bringing IVF treatments to a temporary standstill. A decision that shocked doctors, patients, and the nation.
We just want access and rights to the medical care.
When I found out that my clinic was closing, it felt very similarly to the way that I had felt in miscarriages.
It was shocking, and I knew immediately what the implications of it were.
We were preempting an attack on contraceptives.
Months later, infertility clinics have reopened, but many people are still unsure how the future of family planning will look. The state passed a new law that's protected IVF treatments. Meanwhile, Roark says the state is failing to provide adequate medical resources, particularly in marginalized communities.
The hospital's 2 hours away. They are working a full-time job that they can't take off because they're living in poverty and have to pay their bills.
URGE is looking for policy solutions. This year, working on a bill that would have exempted baby and menstrual products from state sales tax.
We've continued fighting for access to health care. We need to expand Medicaid. We've continue to fight for the material conditions for people who are pregnant and parenting and menstruating.
In Huntsville, Kayla Smith, News 19.